that time of year, you don't know if it's allergies, something go around, or both in some cases, right? So good evening, everyone. I'm Ryan Canada. Kristen has the night off. Thanks so much for keeping it here. So fall allergies, they can pop up, causing discomfort for so many people. Jessica McLean joins us live in the newsroom with details on how to treat those fall outbreaks. Jessica.
Well, Ryan, certainly indeed, medical experts say certain environmental factors play a big role in how our body reacts to the symptoms and that we experience those. But finding the right treatment can help ease our allergies.
To start, when a new patient comes into the office, we start with an exam and we test 100 different allergens. We test some foods, animals, pollens, and different environmental agents.
With fall upon us, different environmental factors can absolutely trigger allergies to worsen, primarily from ragweed, pollen, and sagebrush. Here in northern Nevada, there are also several good clinics and specialists in the Reno-Carson City region that offer allergy testing and treatment.
When it comes to pollens and environmental, once we see how severe that reaction is to the exam, then if the patient opts in to doing what we call immunotherapy, then we send that off to the lab and they're able to compound. It's essentially a compound of different botanicals where it allows your body to ultimately become desensitized to the allergen.
Allergy testing, more specifically skin prick or blood test, helps determine if your symptoms come from pollen, specifically sagebrush, juniper, mulberry, or ragweed, dust mites, mold, or pets. Now, small amounts of common allergens are placed on or scratched right into your skin. Now, if you're reactive, you'll develop a small raised bump, which gives quick results. More sensitive, small amounts injected under the skin, sometimes used to refine when the skin prick doesn't show everything. Allergy immunotherapy can retrain your immune system. Now, allergy shots are given either weekly, monthly, or in 3 to 5 years time span. These are effective for pollen, dust mites, and in pet dander, very common here in northern Nevada.
The reason why we utilize this as opposed to prescribing over the counters is because it is longer lasting. So it's either once a week or twice a week injection, and it's about a year-long program for each person. But what happens is usually it's around 5 vials that we receive in that time frame. That first injection is done here in-house for each vial.
For long-term results, especially starting in the fall, medical experts say regenerative treatment options can provide better results for the long haul. Covering Health Watch, Jessica McLean, 2 News, Nevada.